Glad to have you back. You're still watching Nigeria Decides, and our special focus is on health. Today, in the past 3 years, the nation has been hit by various disease outbreaks that claimed the lives of over 2,000 Nigerians. This has revealed the weakness and poor state of the primary healthcare centers in the country. How can the primary healthcare be improved? We have Olamide Okulaja, the Director, Advocacy and Communication of Farm Access Foundation. Thank you very much for still staying with us.
Thank you.
And we also have
Dr. Eugine Nwosu. He is the CEO, United Heart Hospital. Thank you so much, sir, for being with us. Now, let us put this into perspective. We want to talk about primary health care in the Nigerian healthcare system as a subset of the Nigerian healthcare system. How critical is primary healthcare in healthcare delivery? Let's start with you, Dr. Eugene.
Well, just like when you go to school, you start with kindergarten and primary. You have to get it right. If you really want a student to excel and you give a good foundation of kindergarten and primary, that child will just take off. So in Nigeria, we need a very good, solid primary care center that is accessible and affordable to the majority of Nigerians, because that's the foundation. So what we have is inadequate and grossly underfunded. And I'm not even sure that it's in very remote villages. So primary healthcare system should be available in most rural areas. And then it should be staffed with a qualified nurse or medical officer.
Okay. Now, Dr. Olamide, can you give us a picture of the ideal primary healthcare system that we should have?
So you see, one of the first things you need to think about is, where did this primary healthcare service first come from? And how did that concept come about? In 1978, the WHO, together with the UNICEF and other organizations and bodies, all came together and said, look, how can we define a system that would help us take care of the basic necessities and the basic requirements of our populations, including the availability of clean water, nutrition, immunization, and all of that. And that was when the idea of primary healthcare services was birthed. And if you look at the way primary healthcare services is divided in government, it's meant to be the local government, that are supposed to be responsible for primary healthcare. However, previously I just told you about the low levels of funding available, and even the local governments are still struggling to even fund other things they're trying to do, not to talk of the health centers. And so one of the things we need to begin to consider is, how can we improve the level of primary healthcare services that we have in the country? You look at the Nigeria master list, and out of about 24 to 25,000 primary healthcare centers in the country, you have less than 5% that are actually functional. Most of them are abandoned and derelict. And if you were to look at governments providing funding to revitalize all of these primary healthcare centers, I tell you, the nation itself will go broke. And this is where the role of the private sector comes in. How can governments look at how they can partner with the private sector to facilitate investments to revitalize the healthcare system, especially at the primary healthcare levels?
Definitely. Now, last year, Nigeria allocated 64% of health budget to primary health care. That was the largest from the Ministry of Health, and that's also according to Isaac Adewale, the Minister of Health. Now, do you think this sent any message of a stronger commitment from the ministry, saying that, well, we are taking health seriously, and what should we be doing moving on from that benchmark that was set last year?
So absolutely, you see, the Federal Ministry of Health has made a right decision in moving towards the direction of revitalizing primary healthcare delivery services. And like you have rightly said, the Honorable Minister made a mandate to revitalize 10,000 PHCs, one PHC per ward. And basically that is to sort of look at a system that addresses the primary healthcare needs of the country. If you look at the illnesses and diseases that are plagued by the average Nigerian, over 70% of them can be solved at the primary healthcare level. And so this is a very good, direction that the Honorable Minister has made. However, one of the things we need to also consider is the 1 PHC per ward. Is it something that will be adequate for the population?
But the question I'm asking is that beyond just this first time where we are having the largest chunk, what should we be doing next? 2019, we are already, January is over.
That's exactly what I'm trying to tell you, that one of the things that we need to do is to see how we can increase. So like I've said, the direction is correct. The direction is great. Improving primary health care services, the availability and the accessibility. However, one of the things the government needs to start exploring is how can we increase the number of primary health care centers that are available for people to access these services that they require, right? Because you look at the healthcare system, there are two sides to a healthcare system. There's the demand side and there's the supply side. The demand side basically means how can you put the power to purchase healthcare in the hands of someone, right? And so one of the things that I think that can move this country forward is health insurance, is us being able to invest in how we can mobilize resources, not just from government, but also from people themselves, where the rich pay more so that the poor can access healthcare, and where governments begin to put monies aside into an equity fund that will be used to pay for those that cannot pay. Once you handle that demand side, what that has done is that you have now created a pool that can be used to purchase for healthcare services, right? And so that will then turn into what we refer in farm access to as a virtuous cycle. Because once you begin to have monies that are available to purchase healthcare services, then the supply side will improve, because then they have the availability of cash to improve the quality of service that they deliver, and in turn will encourage more people to join into a health insurance scheme so they can access better healthcare service. And so that's what I talk about when I say a healthcare financing mechanism, because it is a virtuous cycle of demand and supply.
Now let's bring it back to you, Dr. Eugene. I spoke about the need for inclusion in the primary health care system. At that level, at the rural level, how do we begin to include more people? Of course, Dr. Olamide mentioned that it could be financial limitation. Do you agree, or could there be something else?
Yeah, I totally agree. But let me just say something that he talked about, the existing healthcare primary healthcare systems.
Centers, okay.
Even the one that we have now, are they operating efficiently and at full capacity? Is there anybody that has looked into it and make sure that it's very functional? Because you may have numbers there just on paper that you have 10,000 new. Are they functioning? Do you have the manpower, well-trained, healthcare providers or nurses or assistants that can provide the services? So that's important. The second thing is this, okay? We know that you just mentioned the statistics, the average pay of Nigerians. Most Nigerians don't even make $3 a day, right? So how do you expect even people in rural villages? You tell them to go to primary care center, they would pay, 500 naira. Through the foundation we set up, in a rural area of my state, and there's a clinic there. Consultation by a medical doctor is 400 naira. Most people cannot afford 400 naira to make consultation.